Good morning, ladies and gentlemen. Nice meeting you guys again. Welcome to Ewing Baby, I'm Top Doctor. My name is Dee. I'm the co-founder of Ewing Baby. So in previous I'm Top Doctor, we invited the top physicians and attorneys from China, Malaysia, and the United States. So today we're so glad to have Dr. Weena and Mr. James Marshall from Superior A.R.T, Thailand. The Superior A.R.T is one of the most outstanding infertility clinic in Asia. So, Dr. Weena, could you please briefly introduce yourself to our audience?
Yeah, hello everyone. I'm Dr. Weena Krutsawad. Thank you for having me today. I'm a clinical director of Superior A.R.T, Bangkok, Thailand. I completed the Bachelor of Medicine with first class honor from Chulalongkorn University, Bangkok, Thailand. And I've completed the diploma of obstetric and gynecology and reproductive endocrinologist and infertility specialist from Bangkok.
Yeah, Mr. James, so we know you're a super busy man, flying all over the world. So how many times did you come to China?
I've been over 20 times to China now.
Okay.
Many cities and many places in China. I love China.
Yeah, which city do you like most?
I must say I like Shanghai.
Okay. Then please introduce your background to our audience.
Yes, look, I did for more than 20 years research in vitro maturation, in vitro fertilization, and then in the new fields of molecular biology, looking at the genetics. Before joining Genea and setting up a PGT, helping set up a PGT department at Genea, which is one of Australia's premier, or the world's premier, IVF clinical research and training facilities. I came in 2007 to help set up Superior A.R.T in Thailand, and then 5 years ago decided that I loved Thailand so much that I joined Superior A.R.T full-time as a senior PGT scientist. I mean, I just love Thailand.
Okay, so in recent years, and we've noticed that there's an increasing demand. I would say an explosive demand for Chinese people to go abroad for the IVF treatment. So what do you think that happened?
Sure, I think part of it's the mass media. You know, you have WeChat and Baidu, I don't know if I should be mentioning all the name, but you know, these sort of things, people are becoming more educated about the options. That's one of the things. I think the environment that we live in has meant that male infertility in particular is getting worse, and so there's a bigger need for IVF and that sort of thing. Why overseas? I mean, places like Thailand have had a top medical system for over 20 years. So with a great smile, of course, in Thailand, a warm welcome, and an affordable price compared to, say, Europe, Australia, or the USA.
Yeah. So within the Asian region, the Asian Pacific region. So why do you think that Thailand became the most popular destination for Chinese clients to go?
Well, it's close for a start, okay? So, I mean, to go to the US or Europe's further. Thailand from, say, a place like Guangzhou is only just over 2 hours, from Beijing only just over 4 hours. So it's not onerous to go there. As I say, the weather's warm, everything's at an affordable price, accommodation, food, everything's a warm welcome and a great smile, and the medical facilities are first class. They're equal to the best in the world.
Yeah, so Thailand is a country filled with smile, right?
Yeah.
So in our previous Top Doctor, we discussed this, the IVF treatment and the technology with the leading physicians from United States, Russia, Malaysia. Yeah, so what do you think the technology used in Thailand and compare with the technology used in those countries, and what is the advantages?
Look, we have all the latest technology. As I said, we're actually 50% owned by Genea, which is, as I say, a world premier, one of the top 5 clinics in the world in terms of both IVF and PGD or PGS, the genetic screening of embryos, both clinical, training, research. So we keep up with the very latest technology. There's nowhere in the world has better technology, and we have it all in-house and the full range.
Okay, and Dr. Weena, so what do you think who is the best candidate to choose to do IVF?
Actually, while a chance of pregnancy will vary, depend upon a number of factors: age, physical factor, uterine factor, and especially ovarian functions. We have to discuss with the patient which is their problems, or we will try to figure it out. And if we can correct the problem, so it would be better to get a chance of having pregnancy for the individual couple.
Yes, so we've seen a huge volume of patients who are over their 35 years old, especially for the female.
Yeah.
So could you give them some suggestions? So which the factors or the numbers they need to look at when they're doing the test in the hospital?
Yeah, we should do the ultrasound scan to check the antral follicle count, to check the basic follicles that they have, and we have to check the hormone level, which is AMH hormone, anti-Mullerian hormone. It can be presented the ovarian function and ovarian reserve.
Yeah, because in recent years we know that the AMH become like a gold standard, right?
Yeah.
To test the ovary function of a lady. So why is that? Because in like 10 years ago, nobody talking about this AMH, right?
Yeah, it's just like the new investigation techniques that we try to get a research, and we found that it can be presented the ovarian function quite accurately.
Okay, then in terms of the treatment, so the IVF cycle I think it's a little bit different from we use in China. So could you please briefly introduce the procedure in a standard IVF cycle?
We will start the stimulation on the second day or third day of cycle. It takes around 10 days or 14 days to get the stimulation process, and then after most follicles are suitable to correct. So we will do the fertilization with the male partner's sperm, and then we continue culture until day 5 and 6. We biopsy the embryos to do the PGT or pre-implantation genetic diagnosis to test the chromosome abnormalities in the babies. And then after that, we freeze the normal embryo. When they are ready to transfer next cycle, we will do the frozen embryo transfer.
Okay, and I did a simple calculation.
Yeah.
The entire cycle would be like 25 days to 28 days, right?
Yeah.
Roughly.
Yeah, roughly would be around 2 to 3 weeks.
2 to 3
Yeah,
weeks.
yeah.
Okay. Then the following one is the main concern of Chinese patient, so the success rate. Yeah, could you please briefly introduce the success rate within different age groups? For example, under 35 and between 35 and 40. Yeah.
Actually, it's very, as I told you earlier, in age group that would be lower than 30, so we can reach about maybe 60 to 70% after PGT CTH, and over 38 might be a little bit lower, so it would be around maybe 40 to 50% chance of having pregnancy.
Okay, that would be like higher than average success rate than the China market, right?
Sure. I mean, the results at our clinic, it's for normal IVF is something like 40% above the European average. And the China average is probably similar to the European average. For our PGT, CGH and NGS, looking at the comprehensive chromosome screening, it's about 50% higher than the European average. It comes down to a number of things, which I think Dr. Weena touched on. That's a personalized approach to stimulation. Okay, so every patient must be treated as a person. You must look at their individual profiles and personalize both the stimulation and the treatment right through, and monitor it right through to give them the best possible chance.
Okay, just as I mentioned, Mr. James Marshall is the leading PGD scientist in Superior A.R.T. So, yeah, yeah. So let's go deeper. Talk more about the cutting edge technologies like the PCR, CGH, and NGS, because we're always confused about the differences between these technologies.
Sure, it can be divided roughly into two groups. The PGS, which includes techniques such as the old techniques such as FISH, or the newer techniques such as CGH, comparative genome hybridization, and NGS, next generation sequencing, for looking at the status of all 24 chromosomes, all 23 pairs of chromosomes, 1 to 22 and X and Y. And PGD, using techniques such as PCR, and there are other techniques, for looking at specific gene disorders that the patients know they already have. Okay?
Okay.
So FISH, fluorescent in situ hybridization, well, it was old technology used back from the late 1990s, only looks at a handful of chromosomes, had many technical limitations, and everybody, the major clinics in the world have all moved away from FISH to the CGH some 5 years ago, and now to the next generation sequencing, the NGS.
Okay, which means that by using the PGD, so we can target the chromosome and the gene level at the same time, and to filter the genetic disease in the family, right?
Yeah, again, let's divide it into two then. We know that all embryos, in all patients rather, some 50% of embryos will have a chromosomal problem, and that will increase as the woman gets older. It can be as high as 80% in women over 40 years of age. If you do the comprehensive chromosome screening and put back an embryo that is free of a chromosomal problem, you can increase pregnancy rates in these age groups up to 60%. And you'll decrease miscarriage rates from 15 to 40% down to only less than 4%. So these techniques are very beneficial for all patients. The PCR cases, the single gene disorder, that we only use those in cases where the family has a known genetic disorder. Okay, so but you can do them together, as you rightly stated, in conjunction with the comprehensive chromosome screening to give them the best chance of a healthy baby.
So we do the PCR as requested by the clients, right?
Yes, they have to have a known familial, so a family genetic disorder.
Okay. In Superior A.R.T, they're free to choose to do this test, right?
Yes.
Okay.
There's no restrictions on doing PCR if they have a known genetic disorder, yeah. And there's no restriction on doing the PGS if they have particularly if they have a history of recurrent miscarriage or they're older patient, etc. It's very beneficial.
Okay. And from the genetic specialist perspective, so how can we find we have the genetic diseases in our early stage of our life?
Okay, well, if it's a dominant disorder, such as the muscular dystrophies, in disorders such as that, then you'll know, because you'll have it, okay? You'll have the disease and or the disorder, and you'll know you have it, and you're very reluctant to pass it on to your children, and so you're looking for options. Now, the options before PGD, of course, where you found out during the pregnancy and maybe you had an abortion to stop the child having the disorder. Nowadays, of course, you can have the PGD and stop the disorder before you get pregnant. With a recessive disorder, for some things like thalassemia, many countries have screening, or in European countries or Australia, they have for screening for cystic fibrosis, the most common genetic disorders, recessive disorders. Unfortunately, a lot of people only find out they have a recessive disorder when they have the first baby and it's affected by that genetic disorder. Yeah. Okay.
According to your profile, so we found that you are the leading players in the genetic test industry. Like for example, we just mentioned HLA matching and spinal muscular atrophy. And so what kind of are these diseases?
Okay, spinal muscular atrophy is just sounds as a disease that affects both the spinal column and the muscles around the spinal column. Mm-hmm. So you get deformities in growth, deformities in the skeletal structure, and etc. Not a disorder you want to have, but quite a common disorder actually. That's a recessive disorder, so both the parents will carry one gene that's okay and one gene that's not. And unfortunately, if the child gets both the genes that are not okay, they have the disorder. But it's very easily avoidable by PGD.
PGD. And let's talk more about the HLA matching.
Okay, that's an exciting area.
Yeah,
yeah, it's an exciting area. That's where a couple have a disorder that's treatable by a stem cell therapy. Mm-hmm. So they have an affected child already, yes, and it's a disorder treatable by stem cell therapy. So that can be things like blood disorders like thalassemia, hemophilia. It can be non-genetic disorders such as leukemia, aplastic anemia. And they're looking to have, some therapy with stem cells or this type of transfusion or transplants. Mm-hmm. We can give them a child free of the disorder if it's a genetic, and an exact HLA match to the existing affected child, collect the cord blood at birth, harvest the stem cells, and treat the affected child. And so far that's been 100% successful because it's an exact genetic match to the child. That region's an exact genetic match. There's very little rejection or those sort of problems.
Okay. And Dr. Weena, so we know that you did over 700 cycles last year,
Yeah.
right? So what do you think are the main main factors or the contributing for the infertility issues within all the Chinese females?
Sure, nowadays more and more Chinese patients have advanced age.
Yep.
Before they will start the stimulation, it's quite, above 40, so it's quite hard, and we cannot do anything with that, unfortunately. So I do recommend them to maybe get a treatment as soon as possible.
Okay, and which means that the ovary function is decreasing all the time.
Yes.
There's no way to bring them back
Yes.
to their early 20s or something,
no
right?
way, no
By
way.
using medication
Yeah,
or treatment?
No. Yeah.
Okay. Then how is your treatment plan differentiate that plans that used by Chinese doctors?
We will counseling the patient first, and we will find out the problem, as I said, and also we will give them the individual treatment plan, for particular patients.
Okay. So typically, how long did you stay with your clients? During the individual visit?
One visit?
Yeah, one visit.
Maybe 30 minutes.
30 minutes.
Yeah.
Yeah, and we know that in China, because the huge patient volume,
Yeah.
so doctors don't have time to just sit down with the patient and talk about their condition and their treatment plan.
Yeah. At first visit, we have to pay attention with the patients and talk about what they need and what is the previous plan that they already get the treatment of IVF. So we have to discuss about that.
Yeah. So how many ultrasound and hormone tests are you going to do during one standard cycle before the egg retrieval?
Yeah, maybe 3 or 4.
3 or 4.
Yeah, it depends on the follicular development in the patients.
Then, could you please share with our audience latest case or a story with your Chinese patient?
Yeah, I remember I don't have many 40s patients that get pregnant by her own age, but I have one Chinese patient. She's 43 years old, and she came with her daughter, maybe 20 years old, and they want to get a baby. And so I stimulated her own eggs, and she don't have many eggs, maybe at least maybe 10 eggs. And then after we did PGT for 3 or 4 embryos, and they get 1 normal embryos, and they did implantation at the first time, and we get a success. Yes, very good with her own eggs.
Okay, so you prefer the frozen embryo transfer rather than
yes,
fresh
I do
embryo
prefer,
transfer?
yeah.
Yeah, why that happens?
Yeah, because in our research, we found that the pregnancy rate of fresh embryo transfer is a little bit lower than frozen embryo transfer. Yeah, so because of in fresh cycle, we have to stimulate the eggs. We give them the hormone with high doses, and it may be it will change the purpose of the endometrium lining, and it may be the hormone level is not good to do the fresh transfer.
Yeah. So what are the symptoms of a patient who it was hyperstimulated?
Yeah. Mostly would be PCOS, polycystic ovarian syndrome. If a patient would be maybe younger than 25 and there's some problem of polycystic ovarian syndrome, there's a high risk of HSS or ovarian hyperstimulation. Yeah, but we can control with the medication. We have to monitor closely and decrease the doses if possible, so we will get not having OHSS.
Yes. So, and we've seen an increasing number of younger female, like over the 25 years old, between 25 to 30, and they got a really low ovary function. Right? Why did that happen?
Yeah, might be genetics or maybe environmental? Yeah.
Not really. We are seeing, and we're seeing it in the Chinese population in particular, we're seeing that ovarian function seems to be decreasing at an earlier age, and that may be getting even earlier all the time. That may be something, as Dr. Weena has mentioned, to do with the environment. People are living in big cities with more pollution that may contribute, or there may be some genetic factors, not necessarily a single gene, but susceptibility to this loss.
Okay, so from your perspective, so you two guys, so what are your advantages of the Superior A.R.T. compared with the other clinics in Thailand?
There are some good clinics in Thailand. Let's not deny it. There's several good clinics, but Superior A.R.T. has full in-house facilities. We are the only clinic in Thailand with the comprehensive range of PGT and PCR techniques. So from that point of view, we think that's an advantage. We're experienced. All of our scientists do training overseas. All of our senior scientists, not only in Thailand. So we have that experience. We headhunt our doctors. Doctors like Dr. Weena, those doctors have done their full 2 years of OB/GYN, their obstetrics and gynecology. They've practiced. They've done 2 more years of subspecialty in reproductive endocrinology and infertility studies. They've practiced, and then we're headhunting the best from hospitals and that to work at Superior A.R.T. So we think overall we have a very experienced and very good team, an excellent.
Yeah. So how many doctors in total right now?
We have only 3 full-time doctors, but we have several part-time doctors. But all of our part-time doctors must also pass those same standards.
Okay.
I should also add, it's a team effort. It's not only the doctors. At Superior A.R.T, the doctors do the stimulations, do the egg retrievals, do the embryo transfer, take care of the patient from that side. We have experienced scientists take care of the embryology. We have experienced scientists take care of the genetics. So we make sure that every aspect, the whole team is excellent and works together. If one part fails, the cycle or the patient fails.
Yeah, I think you have a satellite clinic in Udon, right?
We have a satellite clinic in Udon Thani that has full facilities except for in-house PGD. We also manage several clinics in Bangkok and overseas, as well as receive samples from many clinics and hospitals in Thailand and overseas.
Okay, so apart from taking care of your own patients, you also deal with the samples that delivered from other clinics all over Thailand, or from Laos, Malaysia, or Vietnam, right?
From Vietnam, from Laos, we're shortly going to be getting them from India as well, yes. As well as several, about 12 or 13 clinics or hospitals in Thailand.
Yeah, so another concern for our Chinese clients is that they're facing the language issue and the cultural barrier. So do you have Chinese-speaking nurses in your clinic?
Not a problem. We have Chinese-speaking patient care coordinators, including one who is Chinese.
Yeah.
We have Chinese-speaking customer service staff. In business development section, we have 2 Chinese-speaking staff. So there's no problem. We will, if patients don't bring their own translator, which many patients choose to do, we provide full translation services for those patients.
Okay, and Dr. Weena, do you have something more to talk to our clients?
Yeah, okay, so please let that be your option of IVF treatment. We are not far from China and easy to go and have many tourist attractions. And also we, besides of lower price, and we have some high success rate of the IVF treatments, and with the easier for PGT and PGS technologies.
Okay, yes, and welcome all our friends to go to the country filled with smile. Yeah. So Dr. Weena and Mr. James Marshall from Superior A.R.T. in Thailand share a lot about the cutting edge IVF technologies in their clinic and a lot of their experience. So I hope you guys learned something from this I'm Top Doctor. We're committed to connecting the best fertility resources all over the world. We expand our collaboration with clinics in the United States, Russia, Malaysia, and Thailand. We're hoping we can help more clients. And thank you so much for sharing your information. Thank you so much.
Thank you. Thank you.
Thank you.